Hello, everyone. My name is Jung, and as many of you know, I am a general surgery resident in my research here. I'm currently in Billings, Montana, and I've spent the past year being exposed to the special challenges faced by the trauma providers here in the rural Northwest. Um, in trauma, there is a concept called the golden hour, which was popularized by the father of modern trauma, Dr. Adam Cowley from Baltimore, which describes this goal of transferring patients to a tertiary center within the critical first hour from the time of injury. However, this is a difficult goal within the rural Northwest due to a variety of concerns, including complex injury mechanisms and really harsh winters. So my project involved looking at a 10-year retrospective analysis of trauma activations here at Billings Clinic, which was just last year designated as the first level 1 trauma center in all of Montana. The trauma registry here contained 8,418 patients, which we pared down to about 4,500 patients given the available data points. And then we categorized the patients as either transferred or non-transferred. And then basic demographic factors, including transfer times and patient outcomes, were compared. For our results section, we had three major findings. First, we saw that the transfers in this region indeed took significantly longer time and traversed greater distances. Please direct your attention to figure 1 on my poster. And transfers averaged about 7.2 hours and traversed 188.4 miles. As context, a recent paper published in Baltimore demonstrated that transfers in that population averaged just 64 minutes and traversed 9.9 miles. Secondly, there was a significant difference in the mortality rates between the transferred patients and the non-transferred patients, about 5% versus 3%. But upon further analysis, this was not found to be significant on multivariate analysis, which is not shown on my poster. On that analysis, variables significantly contributing to mortality included ISS and age. And lastly, as seen on figure 2, most trauma transfers from the most isolated rural facilities were more frequently staffed by APPs rather than surgeons. In conclusion, this project is the largest study with real-world patient data from the state of Montana, and the take-home points for me include the fact that trauma transfers to the largest trauma center in Montana average greater than 7 hours, and also that in the most rural facilities, that the initial point of contact are more frequently APPs than general surgeons. And obviously there are many opportunities for further studies and interventions here, and we're currently working on obtaining statewide EMS data to further elucidate contributing variables and to try to develop some educational interventions to target mid-level providers. Thank you for your time, and please feel free to email me with any questions.